With our next presentation, I am very pleased to introduce to you Dr. Jihan Mahmoud. Dr. Mahmoud has a total of 20 years of experience in nursing education, practice, and research. Her research interest is in young college students' mental health with a special focus on anxiety, stress, and adaptation. During her PhD study at the University of Kentucky, she received the Best Doctoral Student Poster Presentation Award from the College of Nursing in 2009. In 2010, she won the second place for Best Symposium Presentation at the 4th Annual Graduate Students Interdisciplinary Conference at the University of Kentucky. In addition, she received the Delta Psi chapter of Sigma Theta Tau research grant for her doctoral dissertation. In 2016, her published research work received the second place for Poster Presentation Award from the American Psychiatric Nurses Association at their 30th annual conference. As an academician, Dr. Mahmoud is an advocate for emerging adults and college students' mental well-being and implements evidence-based teaching and mentoring strategies to promote and facilitate an adaptive, healthy, and joyful college life among her students and mentees. Welcome, Dr. Mahmoud.
Thank you so much, Dr. Hedges, for this beautiful introduction. So I am going to share my screen shortly. First, before I share my screen and my presentation, my PowerPoints, I would like first to thank you for this opportunity to discuss an important topic that is focused on our students' well-being. And I think we already have started this discussion as Dr. Hedges and Dr. Clark have focused on this aspect of care as well. So I am going now to share my PowerPoints, and then I will elaborate on the general title of my presentation. So, the topic of my presentation is a research topic, and it have in particular nowadays, it is in the current time, it is super important and significant to pay attention to this important topic and to this a population that I would refer to as a vulnerable population. And when we talk about their mental well-being within this context of discussion, we're talking about we're discussing their anxiety in particular, the concept of anxiety. So we will be discussing the relationship of anxiety with certain predictors such as coping, their thinking style, life satisfaction, social support, and selected demographics. First, I would like to acknowledge my co-investigators and actually my professors at that time when the study was conducted, Dr. Staten, Dr. Linney, and Dr. Hall. And of course, the generosity of my university who funded this study. I look at these statistics with pain, and as you can see, this is this graph tracking the anxiety in young adult college students over decades, as you can see here. And I review the report. It was adapted from the American College Health Association, which I review their report annually. Almost every semester, I try to refresh my statistical information about this issue. And unfortunately, it is on the rise. The anxiety and stress in this population, it's on the rise, and I know Dr. Hodges and Dr. Clark have referred to this problem as well, the stress that is provoking the anxiety, or that is contributing to this problem, as well as many other factors that we will discuss shortly. So as I mentioned earlier, I think it is reasonable to refer to this population as a vulnerable population. And currently, the pandemic is contributing to this vulnerability. Basically, the young adult college students, they are in a gray area of their developmental status and stages. Other theorists like Dr. Arnott, Dr. Jeffrey Arnott, who is the theorist of the the father of the concept of emerging adults. He referred to this population as emerging adults, since they are really not adult yet. They are not adult, they are emerging within that theoretical explanation. However, there are many expectations from them to act, respond, and be responsible and commit to many tasks like that are comparable to the commitments of an adult and a mature individual. So in this area, in this gray area of a transition, there is a lot of things that is happening and that is taking place in their lives. And the transition itself, leaving their parents' home, leaving home in general, moving to another state or another place to live in on their own and be responsible for so many things that they were not responsible to when they were with their at home, including financial responsibilities, social responsibilities, and academic, and of course developmental tasks that they need to accomplish and complete at this time, at their time of a transition, which is already a stress-provoking time with any transition. There are so many stressors, so many events and responsibilities that occurring and are parts of the transition. So all that is considered as a burden that is increasing on individuals in this population. In addition, on the top of that, we have the college-related developmental tasks, which is the building their professional identity and learning new concepts and new ways of learning, and progressing and also meeting the expectations of themselves, which we don't know about how the realistic it is, because sometimes there is also the pressure of the society in idealizing certain professions or certain accomplishments, and also the pressure of their parents' expectations, their competition with peers, self-comparison that is also evident in this population and their behaviors, and of course in their values. There is also the peer pressure and influence. So as you can see, there are many factors that burden this population and contribute to their vulnerability and to their, of course, risk for anxiety. So we, as usual in any research study and within any research context of discussion, we go back and look at theories and theoretical explanation to see why this is happening in this population. What can we do to improve the scenario? What interventions we may implement to improve this problem or to target anxiety in this population. There are many theoretical explanations for this issue, including the lack of social support, which my colleagues in previous presentations have referred to or discussed the importance of social support. So the lack of social support, this is a one theoretical explanation leading to anxiety. With this, as I mentioned, they're moving out beside their parents or moving to a new environment, having the responsibilities of developing intimate relationships and developing their own social support system. So the lack of this social support or the difficulty to build this or establish their social connections and social support system in the new place or at the school even or on campus, that contribute to or predict anxiety as per the social buffer theory. The quality of life model, on the other hand, elaborate or explain the level of satisfaction, how satisfied an individual is with their life and how this impact anxiety. So lower levels of satisfaction predict or contribute to higher levels of anxiety. On the other hand, the transactional model of coping elaborate on the importance of coping and discusses two categories of coping, as you can see here, the maladaptive coping and the adaptive coping. The adaptive coping help individuals better manage their stressors and deal with their stressors. Examples of adaptive coping strategies include working directly. The general principle of adaptive coping strategies, as many of you may know, is to actively, target or work on the problem to solve the problem. So that is the general principle. Strategies under this umbrella include seeking advices, problem solving skills, seeking social support, reaching out, and thinking constructively to target the problem. The humor skills sometimes also help. With targeting these stressors, working on managing them, contribute to lower levels of anxiety, and also can be preventive, can have a preventive role of anxiety. On the other hand, the maladaptive coping, which include strategies such as avoidance and substance use, predict anxiety. Of course, with avoiding the problem and not dealing with it will result in that the problem is going to stay there, and that is going to enhance the impact of stressors and lead to anxiety. If we look at the information processing model of anxiety, we can see that negative thinking or negative interpretation of stressors will stimulate or influence the use of maladaptive coping strategies and lead to anxiety, according to this theory. And while on the other hand, the positive thinking, the constructive thinking, lead to using or selecting, making better choices of adaptive coping strategies and better managing the stressors and avoiding anxiety or targeting anxiety. Looking at the literature review, there were a lot of studies that discussed and investigated this problem, and also many interventions were tested. Many researchers all around the world were and continue to be puzzled with this problem and what we can do, what interventions we can do to target this issue in this important population, which is the future, of course, that represent our future with young adults and young adult college students. So in the literature review, I noticed, or we noticed that there is a sequential relationship proposed between thinking, style, coping, and anxiety. And the literature review also supported that the more frequent use of maladaptive coping contributed to higher levels of anxiety. The life satisfaction factor was studied only in one research in this population. So there were not many studies on this that examine this concept or this an intervention that reflect this concept. The social support also predictive. Some studies were supportive of the negative association between social support and anxiety, and some other studies found different outcomes or types of relationships. The demographics as well were evident in terms of their effect on anxiety. Gender continues to be a concern. Females continuously report higher levels of anxiety than the males. Class standing and the living status, living alone or living with someone. So the gap in the literature that we found was the use of a unidimensional approach. So as you can see, theoretical explanations, there are many aspects of this phenomenon. And when we use a unidimensional, of course, we are examining part of the phenomenon, but we need further, we need a deeper look at this phenomenon, and we need to have a comprehensive investigation of what's going on, so that we are able to identify what factors matter the most to better target this problem. So the purpose of our study was to really put these factors in order, and based on their importance and how do they play all together in this problem, how do they contribute, what is their relative contribution to this outcome. So we were looking at the predictors of anxiety and trying to identify what predictors are the strongest. So the purpose was to examine an integrated theoretical model that included as many as possible of concepts that were identified in the literature and in theories as important and as relevant to this phenomenon of anxiety. Based on the literature review and the theories that were reviewed, we developed this hypothetical model and tested it in a sample of young adult college students. As you can see, the model integrated constructs from the 4 theories that I referred to earlier in this presentation: psychosocial constructs, including the life satisfaction and social support, as well as several demographics, marital status, living alone, and the religiosity. We looked also, we included factors that are cognitive behavioral that were from or listed in the transactional model of coping and in the thinking, in the style of thinking. So as you can see here, we proposed that only based on the theories that we reviewed, we proposed that only adaptive coping and maladaptive coping constructs have direct relationships with anxiety, and all other concepts and factors are contributing to this phenomenon, but in an indirect way, as you can see in this model. So we proposed that life satisfaction optimize or negatively influence the negative thinking. So when people are satisfied with more satisfied with their lives, they are less likely to think negatively. We also proposed that based on the literature that females would be more likely to think negatively, and maybe that's the possible explanation why they are also more likely to use the maladaptive coping strategies and have higher levels of anxiety, as reported and continue to be reported in the literature. Also among the propositions were the proposition that positive thinking predict the use of adaptive coping, which predict lower levels of anxiety. From this hypothetical model, the 8 hypotheses were generated and tested in this study. So I discussed several of these in my description of the hypothetical model, but we can see here they are listed. You can see they are listed. So we're going to move to the to discuss the methods section. This was a cross-sectional web-based survey study, and the inclusion criteria were with regard to the age 18 to 24 years old, full-time undergraduate students, and of course needed to have access to the internet. After the IRB approval, we sent out and of course we randomly selected the email addresses of the participants, and 4,000 students received the invitation to participate in this study, and they were passively consented to participate. And later we sent brief email reminders for them to remind them to optimize or enhance the response rate. However, the response rate was 7%, so only we got this. Our sample was 257, and I think that is comparable to a response rate in to a web-based surveys in other studies. In the upcoming 2 slides, you will see this one, and the next one you see the tools and the instruments that were used. We used for measuring the constructs in the model. We used the DAS to measure anxiety. That's the anxiety subscale in the DAS at 21 to measure anxiety. And the brief COP inventory to measure the 2 categories of coping. The brief student multidimensional life satisfaction scale was used to measure life satisfaction, and the positive automatic thoughts questionnaire, the cognitive thoughts checklist, and the multidimensional scale of perceived social support. We used this descriptive statistics and bivariate analysis initially, and then we conducted the path analysis to examine the validity of the hypothetical model. In this analysis, anxiety was regressed on all the independent variables in this model, and then each variable was regressed on the variables that were proposed or hypothesized as predictors of that particular variable. The standardized beta was used to determine the path estimate in the model. Looking at the sample characteristics, we can our sample was representative of the sample or the population of young adult college students at the University of Kentucky, and in terms of their age and the gender. As you can see, unfortunately or sadly, their anxiety level reflected moderate level of anxiety as per the scale that was used for measuring this outcome. The negative thinking was the strongest predictor of anxiety and was directly related to have a direct path to anxiety. Maladaptive coping was also a significant predictor. So these two factors were, after conducting the multiple regression, we found out that they were the only two factors that had direct relationships to anxiety, how that were the strongest predictors of anxiety. So this is the model that emerged, the estimated model that emerged from the study after upon the statistical analysis. As you can see here, maladaptive coping had a direct relationship to anxiety and also negative thinking, with negative thinking having the highest standardized beta, reflecting the strongest relationship with anxiety. Negative thinking also predicted higher levels or more frequent use of maladaptive coping. Consistent with the literature, we found that females are more likely to use negative thinking, and that may be a possible explanation of their higher levels of anxiety that is constantly reported in the literature. The living alone also predicted more often use of maladaptive coping, as you can see in the model, and that will also elaborate or reflect further on the need for social support, and which we'll discuss and elaborate on in the implications. But as you can see here, this is the maladaptive part of the phenomenon of anxiety. Now, if we look at the adaptive part of it, we can see adaptive constructs that don't have direct relationships with anxiety or direct path to anxiety. And we can see that the life satisfaction, for example, have really a negative association with negative thinking, and we can see the other constructs. If we look at the model, we can see that they don't have direct relationships with anxiety. The model suggests that the social support predicts better coping, the more often use of adaptive coping strategies. So that highlights the importance of social support, providing social support or paying attention to the social support system that is available to our students on campus, and to help them with their adaptation. And positive thinking predicted more often use or more frequent use of adaptive coping. Life satisfaction was positively predicted by the availability of social support as well. So social support really a key factor or construct in the adaptive part of this model, as you can see here. There are some limitations of this study, including the fact that it is a cross-sectional design, which is that we cannot prove causality using it, and the low response rate, as well as the use of one setting. So our conclusions from this study And I'm going to go back to the model to elaborate on the conclusion, to address the conclusion better. So we can see here that our roles as academician and clinician and healthcare providers and wherever we are, our role is to target this phenomenon through two paths. First, the preventive way. We need to pay attention to the preventive measures and the strategies and how we should incorporate them. So really not only one factor, implementing one intervention to target anxiety may not be as effective as looking at the phenomenon in a holistic way. So from the very beginning, as our students transfer or join the campus or to the college, we need to pay attention that we have sufficient resources of social support, and we reach and teach our students on coping and the use of adaptive coping and what is adaptive coping and what strategies can be adaptive and what other strategies can be maladaptive, that we need to raise their awareness and pay attention to this important factor. The thinking style, we need also to provide them with resources that optimize their use of positive thinking through, of course, teaching them and incorporating this teaching into the curriculum to make it more available and reachable by our students. So that is important. And the second important role is targeting anxiety when it's there. How we're gonna know? Of course, by screening for the negative thinking among our students and for the anxiety in this population. Screening will help us identify those at risk and identify those who have anxiety. And that is important to then implementing interventions that target their negative thinking to better manage anxiety when it's there. Future research recommendations include further validating this model in a larger sample and a random control trial that would test the impact of implementing strategies that target negative thinking on the anxiety level in this population. So this concludes my discussion, and now I think I have a few minutes. I'm not sure if I have some time to take questions.
Yes, Dr. Mahmoud, thank you very much for this presentation on your research.